The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. Thank you for joining us for today's webinar. This webinar is part of a series being held by the National Alliance to End Homelessness on Rapid ReHousing. Over the past 3 months, we explored each of the core components of Rapid ReHousing: housing identification, financial move-in assistance, and Rapid ReHousing case management and services. Each of those recordings is available online and will hopefully serve as a useful resource for you as you work to implement Rapid ReHousing in your own community. The next part of this series, beginning today, will examine how communities are scaling up their capacity to provide Rapid ReHousing. Today, we will focus on families, but we do want to look at other populations. We welcome your suggestions on further topics and examples of successful communities. We are particularly interested in hearing from communities that are providing Rapid ReHousing to single adults. Today, we are featuring Los Angeles and Mercer County, New Jersey, two very different communities with different leadership structures that have radically transformed their response to family homelessness, greatly expanding their capacity to provide Rapid ReHousing while narrowly targeting richer interventions such as transitional housing and permanent supportive housing to households with much greater needs. The Alliance believes, and the evidence strongly suggests, that Rapid ReHousing is the appropriate intervention for the vast majority of families who experience a homeless episode. We saw great progress from communities who implemented Rapid ReHousing with HPRP resources, but when those resources went away, communities scaled back their effort. If we are to make progress in ending homelessness for families, we need to increase our capacity, and greatly. And doing that means tough decisions around how we currently deliver services and what resources can be reallocated to more effectively and efficiently serve families. Today's speakers will discuss how their communities work to transform their local service system. Libby Boyce is currently the Director of Access, Referral, and Engagement for the Housing and Health Program within the Department of Health Services. Prior to this role, she served as the Homelessness Coordinator for the Los Angeles Chief Executive Office. During the question and answer, Libby will be joined by Johnny Miller, the Family Systems Integration Manager at Los Angeles Homeless Services Authority. We will then be joined by Mary Grace Billick, the Director for Human Services in New Jersey. And if you will bear with me a moment, I am having problems moving the slides. The same problem I had last month. I'm not quite sure what I'm doing wrong. So probably one of my colleagues from next door will show me how to do this. Okay, so that's our speakers. She's showing me how to do this. And just a reminder, the core components of Rapid ReHousing is housing identification, rent and move-in assistance, and Rapid ReHousing case management and services. And not to be overly repetitive here, but we have found that Rapid ReHousing is often being used when only one of these components is being offered. And we just really need your help in communities to say that each of these is important. If you're just providing financial assistance and no help with people locating housing, you're missing a big component. A lot of people out there think Rapid ReHousing means you provide some financial assistance and maybe housing search assistance, but no services, and that is, the services are a critical part of the intervention. So just as a reminder. And I'm going to revisit this slide at the end. So this slide will be up during the question and answer. But these are new resources that have been made available over the course of the last month. So a Rapid ReHousing infographic, a role of long-term congregate transitional housing, what role should it play in ending homelessness, a document produced by the Alliance in partnership along with federal partners, including the U.S. Interagency Council on the Homeless, the VA, HUD, HHS, and the Office of Violence Against Women, and some assessment tools and information about coordinated entry. So with that, I am now going to turn it over to Libby Boyce. Libby?
Good morning, everybody. As Sharon mentioned, I am currently working for the Department of Health Services at the Housing for Health, working with the single adult population. But I previously was the homeless coordinator for the Chief Executive Office of LA County for 5 years, and during that time I worked on the family system, Rapid ReHousing, and we developed a homeless system for care for housing and services in LA. So that's what I'll be speaking about today. So firstly, just wanted to tell you a little bit about our landscape here in LA, because we are, as everyone knows, very large. We are about the size of Connecticut and Rhode Island put together. And so we have many, many residents. We have a large territory. And within the LA County, we have 88 cities. Our political structure is very interesting because along with the 88 cities and all of the city councils that all the 88 cities have, there are 5 supervisorial districts. And those districts, those board of supervisors, they oversee all the health and human service departments for LA County. All funding and service decisions have to be vetted through all of the 5 board offices. Sometimes things go to a vote and they have to either have 3 or 4 votes yes to get anything through. So every decision that we make here has to go through this board, and that makes it particularly challenging. There is only one homeless coordinator based at Chief Executive Office to propose any funding service recommendations around homeless and housing services. I was that person until recently. And the other piece of very important information is that the Los Angeles Homeless Services Authority, or LAHSA, is our COC lead, and they are an LA City and LA County joint power authority, and they administer all of the HUD funding and much other homeless funding as well. Next slide, Sharon. So why do we want to coordinate services, particularly for homeless? Part of the issue is that there's always been multiple programs all over LA County serving homeless families. Some communities have some services, some don't. Families have to go all over to find to meet their particular need. The other issue is that we had experienced HPRP. We got a lot of funding. The county did, as well as the city. And through that experience, we really learned about rapid rehousing and how we can really have big impact on homeless families. So we wanted to scale up that rapid rehousing when HPRP ended. We were aware that we needed a much more regional approach, meaning that we had to have something in which all areas of the county were covered so homeless families could get served no matter where they come from. And there continued to be a large concentration of families that come into our Skid Row area. We have an area in LA County downtown, many, many blocks that is just really bad. Lots of tents, lots of drug use, lots of things going on there. Families really shouldn't be there. Single adults shouldn't be there either, but in particular, families are certainly vulnerable. And also, we had homeless families using the adult shelter system during winter months, so we all know that's not good. Next slide. So setting the stage for our change to a homeless family system, in 2011, we had a convening of all of the homeless family providers in LA County. And because of that meeting and because of the feedback that we received, in the winter of 2011 and 2012, LAHSA implemented a family transition project to test regional coordination of services. And essentially, this took the shelter resources from the adult system of care and gave it to family-centric agencies. So we made that change during the winter months, and that made a big difference. In addition, HPRP ended, and the city and the county were figuring out what we were going to do with our ESG money for rapid rehousing, and we decided to pool that funding together because obviously we should coordinate our efforts and our funding so that we could go farther on the dollar. And we established at that time throughout LA County 6 family solution centers. Next slide. So how did we actually solidify this transition to the coordinated system of care? Remember, we have 5 board of supervisors. We have a lot of people who are stakeholders, and we really had to do a lot of work to get people to buy into this coordinated system of care. We had community advocates and homeless family providers really began to lobby these 5 supervisors and their staff in support of scaling this up and actually allocating additional and existing funding as much as possible to this system of care. We had 2 board offices that were particularly interested in what we were doing, and they held a meeting with the executive staff from LASA, from our Department of Public Social Services, which is our TANF administrator locally, our Department of Mental Health, and our Department of Children and Family Services. The result of this was assigning the homeless coordinator at the time, that was me, to lead a work group to review all of the homeless family programs in the county and to integrate them accordingly. Next slide. The first thing we did in the work group was really think about what we were trying to do. What was our common vision? And so we came up with the principles you see here on the left. It was very important that we had a coordinated system of care, that it was regionally based, that it provided the rapid rehousing and ongoing case management for families to be reintegrated and to be stabilized as quickly as possible. It was also important that we have coordinated entry, so that families come in any door, we're going to be streamlined to our system. And we streamlined our assessment and our triage to housing and resources for our homeless families. Because of our size and the fact that we have lots of resources throughout the county that we may have not been bringing to bear for our homeless families, we wanted a regional collaboration so that the families are fully supported in their needs and they're connected to permanent housing and services within their own respective communities. In addition, we wanted to build upon economic and housing stability to facilitate connections families have to income, employment, education, to ensure that they can have long-term housing stability. And lastly, we wanted to make sure we had targeted interventions, that each family was provided with the housing and services that best meet their needs to obtain and maintain permanent housing. We didn't want to give a family that didn't need that many resources all of our resources. We wanted to be very clear that families that have low need have an intervention that meets those needs, and that families who have high needs receive resources that meet their particular needs. It's not a one size fits all. Next slide. These were the 3 programs that we were asked to really look at by the Board of Supervisors to integrate, to figure out how we could put them together. And as you see, and there, by the way, there's a lot more homeless family services that came to bear when we actually put our system together. But these were the 3 that we were focused on. And as you'll see, the first 2 have a very particular target population. And the last one was the 6 family centers that I mentioned earlier that served all homeless families. So it was very important that we build a system that serves all homeless families and not just a certain cut of the homeless families. You can look at this later. I'm not going to go through this too in depth. Next slide. And this was what was born out of the work group. It was a homeless family solution system, which we have in LA County. Our goal was to implement this regional approach to permanently rehouse families as quickly as possible and connect them to supportive services in their own community. It's really to ensure that we got families housed quickly so they didn't have to come into the homeless system of care. And basically, it combines multiple funding sources to create this one coordinated crisis response for homeless families. And our key objectives were to reduce the length of time a family is homeless, to work towards permanent housing immediately and targeted interventions, and to build upon existing community-based infrastructures to leverage resources that maybe we hadn't been using for homeless families prior, to really ensure that we were doing the most cost-effective interventions. Next slide. So one of the major things we had to do is to establish the supervisor's support and final approval of this homeless family solution system. It took us about 9 months to develop the plan, and it took a few months to actually get the board to approve it. And it took a lot, as I say here, blood, sweat, tears, and gray hairs, although I just got my hair colored, so they're not gray anymore. but they were. We had 3 rounds of board deputy meetings. We had ongoing questions regarding funding, staffing. We had one board office that was particularly focused on not approving this, and that made it very, very difficult. And so we had to really scramble quite a bit for those few months to really get what we needed. And part of that was having a couple of board offices that were our champions that did do a lot of you know, what we call walking the hall here, meaning, you know, going out and really talking to people and getting excitement behind the program and trying to address some of the concerns that were raised. We also had significant community advocacy. The homeless family service providers were amazing. They came out in force. We have an agency out here, a technical assistance provider called Shelter Partnership, and they really rallied the troops. And frankly, our local TANF administrator, Department of Public Social Services, was great at fielding questions and really just supporting the approach and letting the community know that this was really important to solving homeless family issues. Next slide. This is a slide, and I believe that the stars are actually going to pop in here. Yeah, here they start popping in of where our sites are. So as you see, we have sites all over LA County. The very top there, Antelope Valley, is mostly the high desert. So most of that area is the desert. So you'll only see one site there, which is in the urban area of the desert. But these are all of our sites around the county. And if you see all the way out to the left, it's there's not a concentration of people out on the point to the left. But so where you see the stars is where there's heavy concentrations of folks, and so that's us. Next slide. So the results, and this is very important, obviously, the enhancements that we were able to implement. We did combine our funding, and we did this because we wanted to maximize our resources, streamline our efforts, and reduce any service duplication. We wanted families to be permanently housed in their own community. We didn't want them to have to leave their community to get the help they needed. And so by doing this, you know, we were leveraging existing community-based infrastructures, developing connections to support systems that maybe we've never connected to before. Somehow we skipped a slide. Thank you. Then we have regional and coordinated access to housing and services. Again, so families don't have to go to multiple agencies to meet their housing and their service needs. We have targeted interventions to ensure that families get the intervention that meets their needs. We have one Department of Public Social Service homeless case manager outstationed at each of our family solution centers. This provides very quick linkage to benefits and housing services. We have a substance abuse counselor and mental health clinician at all of our family solution centers. And we offer subsidized employment for those people that are eligible, which obviously promotes long-term stability. Next slide. So this is really just about the family's experience before and after. And the important takeaway here is that basically we shifted the burden from the families to meet their needs to the service providers and the funding administrators. In other words, the families get what they need without knowing how it is that it's being funded and so on. We're figuring that out on the back end so that they don't have to get completely inundated with trying to navigate the system. And so before, there were multiple places, needs all over the county, so families had to hop around to get their needs met, and you know, they would fall through the cracks. Now, one agency coordinates all that care. Prior, there was definitely a big duplication of assessments and services, and now we have a comprehensive set of services, one assessment, and all of our homeless family centers can access this information. Before, we really just relied on scarce Section 8 resources. Now, our goal and our complete focus is permanent housing with a range of funding options. Before, there was eligibility around, you know, mental health and being a citizen and different things. Now, all homeless families are eligible and are served. Prior, all families were offered the same resources regardless of their acuity of needs. Now it's targeted intervention. Prior, families were receiving appropriate services sort of a lucky break, and we know that was few and far between. Now these services are standardized, and they're standard practice of care. Before, there was really no coherent vision to ending family homelessness. Now we have a comprehensive and coordinated system. Next slide. This is a slide that shows you all of the funding that we used to start our system, this was what was approved by the Board of Supervisors, and that was back in, I believe, February 2014. So as you see, it's all braided. There's lots of different funding, and we figure out how to use it to best meet the needs of the family. Next slide. Some new developments since February 2014. We received a grant award of additional state funding for CalWORKS families. CalWORKS families is the equivalent of TANF. That's our California term. We got $3.5 million from the state to work, and our grant, what we proposed was to work with CalWORKS families that are not on welfare to work, because we had a lot of resources for families that were on welfare to work, but we didn't have a lot for those who are not, for whatever reason. So this added a very, very important funding for our braided funding model. Additionally, we got money from the Continuum of Care, identified some savings that they allocated to the Homeless Family Solution System in the amount of 1.4. And additionally, there's one-time county general funding of 2.3 that was added, also some savings from some old programs that were done back in 2006. So we really now have a very full program that has the funding that's needed, and we believe we can make very, very big impact on reducing homeless families in LA County. Next slide. I believe that's it. Yes.
That is it. Thank you very much, Libby. And if I can just take a moment to say first, for those who have asked, the PowerPoints will be available. We'll post them. And so you can be able to access this. A recording of this webinar will also be posted online, so you can refer your colleagues to it. And if you have any questions, please submit them in this GoToWebinar box. There's a little tab for questions. Expand that and submit your questions, and we've reserved plenty of time at the end for dialogue. So I am now going to turn it over to Mary Grace. Mary Grace?
Thanks, Sharon. I wanted to, one of the things I think is really important, and I appreciate that Libby gave everyone the scope of the work she had to do. That was an amazing accomplishment, Libby. Because when you look at Mercer County with 360,000 people, whereas LA has 10 million people, it's a very different picture. Also, we have 14 municipalities. So like your 88 cities, we have 14 towns. And really the city of Trenton, which is where the majority of our population reside, is 7.5 square miles. So the scope is, and the scale is very different. So I appreciate that you're giving everybody a chance to see the difference, Sharon. And also thank you for promoting me. I am the Human Service Director for Mercer County, not for the state of New Jersey. That is a big job.
Sorry.
So looking at how our system was when we started this, and we really started to look at it with our 10-year plan in 2005. And then in 2007, we said to ourselves, we're actually managing homelessness with our 10-year plan to end homelessness, not trying to end homelessness. So the way that everything used to go before, as you can see, is our old system manages people in shelters. They'd go from emergency shelter, they'd have a housing crisis, emergency shelter, transitional housing, and then sometimes to permanent housing. Those permanent housing outcomes were not often infrequent, and they were often done as incentive. Participate like you're supposed to in a program, and maybe you'll get permanent housing at the end. There was no way to look at the front end to help identify and prioritize family with highest need, or to distinguish those who could be rapidly rehoused. People stayed in transitional housing too long. And when we look back at some of those numbers, 777 days, 600 days, you know, some families would stay in a transitional housing for 18 months. We weren't ending homelessness. We were spending $10 million just from the TANF agency. And our average length of homelessness was 337 days. So most of a year, our families would spend homeless. Next slide. So in order to actually accomplish this, we had to do exactly what LA did, which was get everybody at the table and to develop a common goal. The first thing we did was to put all the funders together, because if the funders make decisions about how they're going to spend their money, that included the County Welfare Agency, the Human Service Department. We had the United Way at the table. We had the City of Trenton, and we also had buy-in from the State of New Jersey, our Division of Family Development. We spent about a year doing that, and then started to meet with the community. The National Alliance to End Homelessness helped us, actually, by coming to New Jersey a number of times to meet with executive directors and board members of some of the local agencies to help them understand where we were going and to get their buy-in. It required an enormous amount of collaboration, and I would say that took about 9 months as well, meeting with people and talking about our new direction, talking about what it meant to give families, to house families first, and to use a rapid rehousing model. We had a redirection of our funding. We also were the recipients of one of the 15 HUD rapid rehousing grants. So we had a 3-year pilot project where we had an opportunity to do it. We did it with both TANF families and non-TANF families. Next slide. So this is what I think it's going to pop up something else, Sharon, right? There's a header. It might come in like Libby stars, or maybe not. Okay. No. So right now, the way that this works is we have a single point of entry. Oh, there it is, rapid rehousing for families. Every family, every single family who needs, who's in a housing crisis and needs housing resources, comes in to the Board of Social Services, and they are screened and assessed for service. They are provided short-term shelter to resolve immediate crises. Our length of stay in shelter, because we're shooting, of course, for the HUD standard, but it is between 45 and 50 days to develop housing stability plans with families, to assist those families in finding the housing, and most importantly, to negotiate their rent with the landlord. That is one of the things that has proven to be immeasurably helpful to families, because they need somebody else who has an expertise in reading a contract. You don't want a family signing a contract that obligates them to, you know, shovel the sidewalks and have their utilities. Every utility is an extra cost, because we know that if their housing cost is appropriate and managed within their budget, that they're going to have long-term housing stability. To provide rental assistance and utility assistance, and of course, as Sharon started off with saying, is the case management services. Without helping them navigate and negotiate the social service systems, our social service systems are, I think, purposefully challenging so that people don't get through them. And the case managers help people navigate those barriers. Next slide. So since 2007, the number of homeless families in Mercer County, oh, okay, That's okay. Has declined by 74%, and it's a very striking number. That number, of course, in New Jersey is 38%, which is an amazing accomplishment as well, and 16% nationally. All right, next slide. What we really found is that it works, and it works so well that it is our standard intervention. We use Rapid ReHousing we look at every single family to use having a Rapid ReHousing intervention. Now, of course, there are, which is what we found, 10% of our families who need permanent supportive housing and need a higher level of intervention. And what happens is that they actually are diverted. So every single family comes into our system through our TANF agency, and those who have higher level of need or are non-TANF families, they're actually diverted to a local nonprofit who provide Rapid ReHousing. The remainder of those families are seen by our TANF agency. They have completely reorganized their service provision to do Rapid ReHousing as one of their standards of practice. So it decreases the length of time on public assistance. This is exactly our Rapid ReHousing families are actually TANF recipients for only 189 days versus transitional housing. They increase their monthly income. Rapid ReHousing families have a 50% increase, and you can see the difference for transitional. And I think most importantly that our families do not come back into our system. We track every single family, person, everyone in our system through the HMIS data system, and we can watch the front end. And it's actually something we look at monthly at that data. We don't, that's not a number we ever let far from our site, because if the number goes up, we want to know why. Next slide. So again, this is one of the most important things that we found, because it also we needed the information to say something to our state partners that indeed spending money on the front end, which is getting people rapidly rehoused, getting them out of shelter, and in our system no longer spending that money in transitional, we needed to show that it actually had a cost savings to it. And as you can see here, the old system, which was shelter to transitional and then sometimes into permanent housing, the new system is really Rapid ReHousing. The cost is half, which is a significant change. It's also a change when a family who has a maximum amount of time that they can stay on TANF is off of TANF within 4 to 6 months. That means they have more time left in case sometime in the future they need to come back on to TANF. Next slide. So this is where we are right now, and this is something we, as I said a few minutes ago, we pay attention to this all the time. It's always on our radar screen, looking at places we need to adjust, considering what our prevention strategies are to keep families out of homelessness. Our TANF agency is a single point of entry for our homeless system, and they have a screening tool that they use on the front end and make the decision whether the family needs to go into Rapid ReHousing or permanent supportive housing. We have 2 iterations, as I described. One is the TANF agency, and one is a local nonprofit. The non-TANF clients, of course, go to the local nonprofit. And we also will divert a high-need family who really need more support getting into permanent supportive housing to the non-TANF agency. There are subtle differences in the program. One is related to income. The TANF agency actually has staff in bed in our one-stop program, and that's where the linkages to employment are happening. The nonprofit organization actually has a job developer and a job coach as part of their staff, and we see a difference in the incomes and the amount of money that the family is earning at discharge. I think that and I'll say the subtle difference between the two is really that the TANF agency's goal is to get you employed, get the family employed, whereas the nonprofit organization is invested in getting you the right job, which is a job that is making a living wage. So that difference we can definitely see in our data. We've done some prevention models that use shallow subsidies to support families whose incomes are not going to be able to sustain the housing, and those are permanent support, $100, $200, whatever that, sometimes $3, and that's something that a family may keep for an extended period of time. In 2012, Mercer County, the Trenton Mercer Continuum of Care, made the decision to close all of our transitional housing programs. We started this process in 2007 with 84. By the time we closed the transitional housing programs, there were about 30, 34 left. Next slide. So since 2010, 975 families have been rapidly rehoused within 54 days of coming into the system. This is 1,600 children, and why I think that's important is that those were previously children who stayed in transitional housing and were not in their own school district. So they were yet again going to move into another school district. Our families have a 50% earned income increase, and their length of time is from a year to 6 months, but it's really closer to 6 months. It decreases the length of stay in shelter, and best of all, 94% of those families we never see in our system again. Next slide.
Mary Grace, could you speak up just a little bit? I think some people are having trouble.
Oh, sorry. Yeah, sure. How's that? Is that better?
Yes, I think so.
Okay. Okay, great.
I think I've missed your outcome slide. I don't know why. So if you could make sure not to skip over that, or was that in the previous slide?
No, I think. Hold on. I don't. Hold on one second. Let me see. If you mean you don't think you have it on the on your.
I don't have it on the PowerPoint, but I have it in my notes. The outcomes since 2010. 975 families have been permanently housed. 58 families returned to homelessness. Okay, got it. Okay.
Okay, go down one more. The one before this one, child welfare connections. I think there it is.
Yeah, I think we might have inadvertently lost that slide. So if you could just
go over.
It was in the previous slide. Somebody tells me. So
yeah,
the data was in the previous slide. Okay. There we go. Sorry about that.
Oh, I know what you're talking about. Yeah, I think it's okay because it was in there. It was in the previous slide, yes. Okay. Is that okay?
Mm-hmm.
Okay. So I think that for us kind of on the horizon, one of the really exciting things is the connection with child welfare. And as I had said when we were in San Diego a couple weeks ago, that we're looking forward to the child welfare organization here in New Jersey to release some requests for proposals to put rapid rehousing in. Actually, they're using a keeping families together model. So what really happened was we did some data sharing and a presentation on rapid rehousing with the commissioner and her staff, which then led them to start doing some data mining. When I came back from Seattle, I guess it was 3 years ago, I went to the Child Welfare Agency and I said, you know, some of these organizations around, some of these places around the country, the reason that people come into child welfare is because they have housing instability. And our staff here in New Jersey said, we don't know, we don't actually collect data like that, so we don't know. So about a year, maybe a little over a year ago, the division started to look at that information. And they discovered indeed, they do have families who end up in their system because of housing instability and stay in their system. They then created a high-level position in their infrastructure to begin to look at and to, really do some national research. and implement rapid rehousing-like projects. Today they have 2 Keeping Families Together models, one in Essex and one in Ocean County, and their intent to have at least 5 additional ones throughout New Jersey. So it's really an exciting opportunity for all of us. And next slide. I think that's it.
That's great. Thanks, Mary Grace. And just in reference to what you were just talking about, the child welfare and looking at how child welfare agencies can support families who are homeless, one of the things that you're looking at is, of course, rapid rehousing for child welfare-involved families, and the Keeping Families Together is really a model looking at permanent supportive housing. And if I can just provide a plug for my friends at the Corporation for Supportive Housing, they did a great webinar yesterday, and Deb Lancaster from New Jersey talked a little bit about what New Jersey had done as far as looking at their data and targeting permanent supportive housing and the research that they're hoping to do and some of the experiences. So I think you can take a look at CSH's website in the next couple of days and find a recording of that. So yeah, if folks want to learn more about that. Okay, well, great. So we have some time left for some questions. So if folks have any questions for the presenters, please use the dashboard to email them along. And I'll use one to just kick us off, and that's to ask, you know, each of the presenters, and Johnny, if she wants to join in from Lhasa, what, you know, essentially, I think our fear at the Alliance is that too often rapid rehousing is sort of a boutique, a kind of a marginal, oh yeah, we have rapid rehousing. We've got maybe 20 families a year that we're serving. In order to kind of scale it up, it means winning a lot of hearts and minds and confidence and, you know, and taking kind of giant leaps forward, which, you know, in implementing something which is still quite new for a lot of people, particularly policymakers. If you could each speak to what you think some of the most compelling arguments for making this leap of faith, for investing new resources, what worked in getting people interested, policymakers, people with money, in getting them interested in doing this? So whoever would like to start.
I'm happy to start. This is Libby. I think that there's a couple things. Absolutely money. Money always talks, and certainly for the politicians. And I think that Mary Grace's slide, I think it was a couple prior to the last one, really gives you great fuel for having this conversation. The bottom line for us in LA was that when we looked at our outcomes with transitional housing, it was very costly and we weren't getting people permanently housed at a rate that was acceptable. So for us, that's pretty much what it is. I think that the thing about the boutique, you know, rapid rehousing, when you just say it, people say it and assume everyone knows what you're talking about. And I think that instead of throwing around the term rapid rehousing, the bottom line is it's, you know, short-term rental subsidies while you help somebody get stable. And so being clear of what it provides and what the alternative, you know, prior work that we had done taught us about this can work for families. Most families, 80% of families just need a little bit of help for a little bit of time. Those families that need a lot more help, let's give them a lot more help and let's focus on them with a different model. So, you know, that's the kind of messaging I think that's very important, and Johnny may want to add additional information as well.
Hello, this is Johnny Miller with LASA. I think that really what it came down to is that, and Libby's kind of already hit all the key points, is that it's a much more cost-effective model, and it was moving families into permanent housing much more quickly than what we saw in the shelter system. In addition, what we saw under HPRP really demonstrated that it was an effective model for families. I would say even still to date, only about our recidivism rate is still hovering right around 10%, which tells us that it was an effective model for our families. And so that was the cost effectiveness and just the impact that it had on the family was key for us.
So my opinion, and I totally agree that that's the way to talk to your funders. That's the conversation we have very, very often with our state partners. This is really from their perspective. If they're trying to do things that make sense. But I think on the other side, and I know everyone would agree, is it's the right thing to do for the family, right? Trapping a family in a system where they're stuck for 6 months or 18 months, and they're really never in their own space, that's not the right thing to do. I want to echo what Libby says, that 80%, it may be even higher than 80%, but these are families who had something happen, right? They don't have good support systems, and they had a car broke down, they lost a job, their child was ill, and found themselves in a housing crisis. They don't need you to tell them how to parent their kids. They need you to help them get back on their feet so they can move on.
Okay. I'm going to ask this. I'm sorry.
I was just going to add one thing really quickly is that, you know, I think the beauty of the rapid rehousing is it really allows you to tailor the intervention to the family. And the lack of the cookie cutter approach with rapid rehousing, I think, also made it very, I don't want to use the word popular, but it made it very favorable. It was a favorable result for a lot of our you know, especially our board deputies who really did not like the cookie cutter approach. So the ability to tailor with rapid rehousing programs is another key factor. And then I'm done. Thank you.
Okay, and just as I ask some more questions, I've gotten a reminder from somebody in the audience to, you know, please speak clearly into the phone. I think they're still having some trouble hearing periodically. So this question, and I think Los Angeles, you folks should answer it first, and then Mary Grace, if you have anything to add. This person is interested in the ages of children and the families being served and how you are coordinating with the early care education and attending to the education needs of children, and how you are partnering with child development programs and attending to, you know, placing families where there are services for children. You know, and I know Libby and Johnny are going to be speaking kind of from the more macro systems perspective and can maybe talk a little bit about the role of First Five and being placed in the Family Solutions Center. But I know that this has been something that Shelter Partnership has gotten very invigorated about, and so to the extent that you're able to share some of those lessons. Johnny or Libby, who should start?
I'll start and I'll pitch it to Johnny. I think we had, very early on, we actually contacted a child care provider in each of the areas that the Family Solution Centers are and made a connection so that they could, and obviously it was the child care that the county subsidizes for our families. So we made those connections very early on. The ages of the children are anywhere from birth to 18, and I'm sure we have some adult children as well. In terms of First Five, we have some funding that, the nice thing about our system is now we have this infrastructure that if entities want to add additional dollars to target a certain homeless family population, they can do that. And so in our case, we added some First Five dollars, which is actually monies that have come to us through a tobacco tax, through a voter initiative some years back. And that includes services for, oh my goodness, for child care for all children who need it. And so that we have some First Five funding there. So we use all of their programs as well. We connect with them. Johnny, is there anything else you can add to that?
Yeah, I would just add a couple of things. Is one that, you know, our approach with having Family Solution Centers be regionally located helped allow families to stay in their neighborhoods and communities, which caused some minimal disruption to children at school. So they're able to stay close, stay in their schools. The other thing is that we have very close relationships with all of the homeless liaisons, both in the county and in the city of Los Angeles, so that we can help children, you know, with transportation to and from school, that we can help advocate for children to be able to stay in their schools while the family is experiencing homelessness. We also had a partnership we have a huge partnership with 211 LA County, and within 211 LA County, there was a child development screening group who we had a direct referral relationship with, and they were pretty much screening all of our children under the age of 3 for any developmental delays, and would work with the parents very closely to make sure that children got connected to regional centers or were further evaluated for whatever their assisted development needs were. And we also, through the partnership with First 5 LA, we were able to provide a lot more technical assistance and just sort of information on the developmental needs of children, especially as it relates to education. And so what we've started to see over the last year and a half is a shift in the on-site services that are provided through the child care centers at our emergency shelters. And we're starting to see that the emergency shelters are now providing more targeted child care assistance as opposed to just, the kids playing on the playground. They're really now trying to incorporate some of these growth opportunities and ensure that the children continue to develop in terms of cognition and language, because we were starting to see delays in that. So the partnership has been really great and has helped really help move our system along, and I think make us more responsive to the developmental needs of children. And I don't know if Mary Grace would like to add anything.
I mean, of course, we don't have the centers.
Speak up, Mary Grace. I'm sorry.
Oh, okay. I'm trying to. I picked up the receiver thinking that would help. Did it not help?
It's a bit better, yeah.
Okay. So, I mean, really, I think it's part of the case management. New Jersey has a lot of subsidized child care. Both statewide subsidies and county subsidies. So part of the case manager's responsibility is to help link families with the appropriate before school, after school, and child care resources. So that's, again, because that's one of the things that can create housing instability is if someone has to leave a job to go pick a kid up after school, or not being able to drop a child off before school. So there's a lot of work that goes into making sure that they get access to those resources.
And this is Sharon. So I'm just going to add in my personal plug. We, by and large, about half of the children who experience a shelter stay, our most recent data, is age 5 or under, and it skews young. So you're more likely to be under the age of 3 than over the age of 3. So in that time from 0 to age 5. So one of the things that the Alliance has been very interested in promoting, and we use the questioner's help, Grace, Whitney, from Connecticut, is really around how do we match quality child development services with quality homeless services. And we definitely want to have a webinar on series. We want to follow one of the webinars that we want to focus in over the course of this series is really looking at Rapid ReHousing partnering with home visitation programs. And home visitation programs are programs that are evidence-based and providing targeted assistance to improve the child's health, education, and development. And it's targeted to children who are highly vulnerable, and a highly vulnerable group of children are children in poverty, and of course we have lots of them. And there was a lovely article in the New York Times just yesterday, if folks want to Google it, about a formerly homeless woman who's being assisted by the Nurse Family Partnership Project. I forget what state it was in, but I think it's, as you build up your rapid rehousing capacity, you should also be looking at new partnerships. You should be crafting that can provide ongoing support to families, not only while they're homeless, but actually really focused on helping them stabilize when they're exiting homeless. So there can be an ongoing source of support for both the child and the parent. So just a little commercial break, but we're definitely going to want that. And if you're doing that in your community, please let us know, because we want to highlight places that are doing that well, and people in the administration are really excited to work on this as well. So we have, we actually have until 3:30, but we may not take that much time if folks didn't have a lot of questions, but I'm going to ask a few that are in here. I'm not going to answer questions about permanent supportive housing. I'll do that separately. One of the questions is one of the things I know that happened in New Jersey, which I don't think was terribly comfortable, it was that you eventually moved a lot of resources out of transitional housing to fund rapid rehousing, and when Los Angeles is looking at redesigning their system, they're also kind of circumventing or figuring out a new way to do referrals and referring less families to transitional housing or other interventions. You're deciding at the Family Support Center who needs these more intensive interventions rather than letting each individual program decide. Could you talk a little bit about how you got buy-in or didn't get buy-in, or how you tried to get buy-in from the partners who had been doing homeless services in the community before and weren't necessarily thrilled with the idea of changing what they were going to be asked to change? That might be a dicey question to ask in a public format, so however you want to.
This is Libby again. It's very interesting. I think what helped us a lot was that there had already been so much discussion through HUD and through the National Alliance and through the Interagency Council and on really looking at transitional housing and how effective it was. So that had already been going on for a number of years prior to us even thinking about the family system. And for us, really, what helped us completely, and we could not have done it without the homeless family providers. Now, in LA, a lot of those homeless family providers weren't necessarily providing transitional housing for families. So I think, a lot of the transitional housing was sort of already starting to think about, making a shift. And plus, a lot of our homeless family providers weren't providing the transitional housing. But again, it goes back to looking at the outcomes. And when we pulled the outcomes, very few families got permanently housed. And so it's very hard to refute the fact that after 2 years of spending a lot of money on a family, they're still homeless. It really, I think, kind of spoke for itself. But the national dialogue definitely helped, and our homeless family providers in LA were extremely supportive of moving towards this systemic way of addressing homeless families.
Yeah, no, I think Louie's hit the nail on the head. It's a hard conversation to have, but the data speaks for you. And when you can look at, if you can look at the transitional housing outcomes, whether it's your continuum of care or your HMIS data or whatever system you're using, that tells the story for you. It was a little more challenging. That was one of the reasons we started those conversations and had nonprofit boards of directors and their executive directors sit down and listen to how the system is going anyway, because they then had the opportunity to see for themselves, were they going to embrace rapid rehousing or were they not? And so, as the numbers of referrals into the system start to drop off, people have to make decisions, business decisions. So we did give them, well in advance. We told them probably 5 years ago that transitional housing was not getting great outcomes. And then within 2 years after implementing rapid rehousing, of course, the referrals into transitional had plummeted. And so agencies had no choice, but they did have a heads up that it was coming. And we're able to participate in the dialogue kind of as a community.
Okay. Well, as a reminder, here's this webpage up here, or this slide, has some new resources that you may want to take a look at. And I want to thank everybody for joining us for today's call, and in particular, Libby, Johnny, and Mary Grace for being such stellar examples. And if you have suggestions for other things that you would like us to do a webinar on, really kind of that might help you improve or enhance your rapid rehousing system in your community, please do let us know, because that's exactly what we're trying to do here. So thank you all, and we'll be back next month highlighting 2 other communities and how they are attempting to take rapid rehousing to scale. So send your suggestions along. Okay, thank you.
All right, thanks, Ann. Bye, Libby. Thank you.
Bye-bye, Mary Grace. Bye, Johnny.
Bye, thank you.